Let's study the normal development in children. The norm why development is important to study. It is basically one of the key pillars of pediatrics. So what are the other pillars of pediatrics? The other pillars are growth, development, nutrition, and the vaccination. So these are the four key pillars of pediatrics, and general pediatrics covers them all. So let us study the period of growth. It is very important to know the terminologies behind each and every stage of the life. The first comes the ovum. Ovum is basically 0 to 2 weeks. Next comes the embryo, which is from 2 to 8 weeks. And then comes the fetus from 8 weeks to the birth. And then the perinatal period from the 22 weeks of gestation until the 7 days after birth, stage of life, and the age. Let's know the each and every term. The first is the neonate. A neonate is called the baby of 0 to 28 days old. Next comes the infancy. The infant. It is a child who is less than 1 year of age. So every neonate is an infant, but not every infant is a neonate. The toddler, that is from 1 to 2, 3 years, or 2 to 3 years of age, the toddler. Then the preschool from 4 to 6 years. Then comes the school age, that is 7 to 12 years. And then comes the important term, that is adolescence, which is from 10 to 19 years. All these terms are important. You may pause and learn them. Now coming to another, what we will learn in the development today is definition, principles, factors affecting, protective factors, domains, and the development assessment tools. All topics are very important. You need to remember. Let's dive into definition. The developmental definition is: development refers to the maturation of function and the acquisition of various skills for the optimal functioning of an individual. It is nothing basically the brain development. It is a brain maturation. What all the brain is needed to feed, and that is processed and results in upgradation of the brain. Just like we have a software in the mobile which is upgraded time to time, so is the mind of a child. So the brain development requires the maturation of the functions of the brain, and for that maturation we need to acquisition of the various skills for the optimal functioning of an individual. Just like in order to stand, we need to first hold the neck, then the child need to roll over, then he has to sit with support, then he has to sit without support, then he has to stand without support, then he has to stand without support, and he has to walk. So everything that requires the development of skills. So development is this. And then another concept is the early childhood development. It is nothing that these days it is given stress because the early childhood development is important because the maximum brain growth, that is the brain develops maximally up till 2 years. 90% of the brain grows, and another 3 years almost completely the brain grows. So 99% of the brain grows in the early childhood age. So we have to focus on the first 3 years on physical, motor, socio-emotional, cognitive, linguistic development for overall development of a child. Now coming to the common patterns of development, coming to the principle. Principle is very important in this. So what are the principles? The continuous process. So development is a continuous process. It is not discrete. That at 3 months the child will hold the neck, at 4 months he will roll over, at 6 months he will sit without support, sit with support. It's not that discrete. It's always the continuous. Some children grows early, some late. Every second the child grows, the brain is developing. So it is a continuous process. Next comes the depend on the maturation function. Yes, every brain, every child is different, so every development, the development depends upon the functional maturation of the child. Next comes the uniformity. In all the children the development is uniform. It first this it is it pattern, the sequence is followed. Like for a child, in order to walk, he has to need to hold the neck, he has to roll over, he has to sit with support, he has to sit without support, he has to stand with support, he has to stand without support, then he will walk. So it is a sequence, it is not directly. If a child is jumping the milestone, it is not normal. So next, coming to the cephalocaudal direction, the principle, the development begins from the head and then gradually goes to the toe. So it is a head to toe direction, that is cephalocaudal. Now coming to the attainment of certain milestones require primitive reflexes to disappear. It is very important that to attain certain milestones, the primitive reflexes has to disappear. For example, in order to bite, the sucking reflex has to go. So it usually the sucking goes around 6 months. So the child needs to bite, then he has to the sucking reflex to go. Another example might be if a child want to hold an object himself, there is a palmar grasp reflex, which is basically in the neonate, if you touch the palm, it automatically closes the palm. So it has to be disappeared in order the child to approach that object. So for the voluntary grasp, the involuntary grasp reflex has to be gone. So it is basically the attainment of certain milestone require primitive reflexes to disappear. Next comes the factors affecting the development. There are basically three factors which affect the development. First is the prenatal, then the natal, and the postnatal. Let's study the one by one prenatal factors. Now, what are the prenatal factors which affect the genetic factors and the maternal factors? Now, the genetic factors and the maternal factors are basically the poor nutrition. A poor nourished or the undernourished mother basically give rise to an undernourished child, which later becomes an undernourished female, and that undernourished female again develops into undernourished mother and then undernourished baby. So this is a vicious cycle. It has to be broken. In order to break this cycle, we have to provide the nutrition. Next comes the anemia. Anemia during pregnancy. An anemic mother, or you know that each and every nutrient is carried to the baby through the blood. If the blood is less, then the nutrition provided to the baby is less, the growth is less, the development is less. So anemia needs to be corrected. Next is recent pregnancy. If a more number of children, the more number of children leads to less focus on each individual, less nutrition to each individual, hence leads to poor development. Next is substance abuse. Alcohol, cigarette smoking leads to decreased development or abnormal brain functions. Next is PIH, that is increased BP. Raised BP during pregnancy causes decreased development. Next is chronic illness. Any illness during pregnancy or any chronic illness in the mother may lead to, like hypothyroidism, may lead to developmental delay. Next is torch. Torch is basically group of infection during pregnancy which may affect the child's growth, basically child's brain. Now coming to the natal factors or the neonatal factors, the small for gestation, a small baby may result into developmental delay or less development. Prematurity, the greatest risk of a cerebral palsy is prematurity. A premature brain or the underdeveloped or the less developed brain is prone to injury after birth. So it is a prematurity's greatest risk factor. Next is perinatal asphyxia. Perinatal asphyxia is also important as the brain injury due to hypoxia or the asphyxia before birth or at the time of birth can result into new developmental delay. Next is hyperbilirubinemia. Hyperbilirubinemia is basically increased level of bilirubin that can affect the brain. It is one of the most common causes of acquired causes of cerebral palsy. Next coming third important factor, that is postnatal factor. The postnatal factors include the child nutrition. Any infant or the child who is not given the adequate nutrition can result to developmental delay. Hypothyroidism, it is the most common cause of acquired brain loss. So hypothyroidism needs to be corrected. Infectious disease, a child getting recurrent infection may result in undernourished, and so is the brain development. Toxins like lead, mercury. These are the toxins which lead to impaired brain development. Acquired insult to the brain, like any trauma. A child is growing well by 1 year, then suddenly he meets an accident, and then he loses the function of the brain, or there is a decrease in the development. That is basically trauma. Associated impairment, like if a child did not hear since birth any word, anything, then he is likely that he won't be able to speak anything. So in order to speak, you need to hear. So associated impairment like hearing defect may lead to speech delay. So the developmental delay. Others might be psychosocial development, like psychosocial is parenting, surroundings. A cheerful, playful surroundings lead to better development. Violence and abuse, maternal depression, a depressed mother leads to less feeding, less caring, hence leads to decreased development. Now, so far we have studied what are the factors that negatively affect the development. Now, let's study what are the factors that protect the child or to promote the child's development. First factor is most important, that is breastfeeding. Breastfed child is likely to develop well than a non-breastfed. So breastfeeding provides adequate nutrition. It provides basically immunity. Breastfeeding also provides certain factors which help in brain development. So breastfeeding is very important. Next comes the KMC, kangaroo mother care. It is basically providing the warmth to the baby so that the baby develops more. It is more important in premature or a low birth weight child. Next comes the optimum nutrition. A well nourished leads to better development. Absence of illness. No illness, better development. Secure home. A secure home is a home that results in better development. Exposure to stimulating, cheerful, playful environment results in better development. So the child playing with toys, playing with the kids, it leads to better development. So next, last is educated parents. So educated parents leads to better development because an educated mind is an open mind. He is ready to listen to the ideas, and that ideas can be interpreted. He can access various information. Hence, education leads to a protection factor for the child's development.